Welcome to the new EAU podcast series, Women in Urology, Dare to Thrive. In this third episode, Women Surgeons in Asia, Pioneering Progress. We are joined by Dr. Kinju Adhikari and Dr. Steffi Kar Kei Yuen. Together, they will discuss the experiences of women surgeons across Asia, highlighting the progress made, cultural and institutional barriers, and strategies that empower the next generation of female urologists. Join us as we embark on this informative journey.
Hi, a very warm welcome to the audience. I'm Dr. Steffi Kar Kei Yuen, a urologist with focused endourology interests based in Hong Kong. I work at the Chinese University of Hong Kong. Today, we have the privilege of hosting a conversation with Dr. Kinju Adhikari, the first female urologist from Nepal, a leading robotic surgeon. Hi, Kinju.
Hi, Dr. Steffi. I'm Dr. Kinju Adhikari. Thank you for introducing me so lovely. Welcome to the podcast. I am a urologist, uro-oncologist, and a robotic surgeon. I work in HCG Cancer Center in Bangalore, India. I am originally from Nepal, where I became a first female urologist. My clinical focus is mainly on uro-oncology, and my special interest is on prostate cancer and AI. It's very interesting to have a talk with you, Steffi.
So exciting. We also need to thank the EAU and the EAU Educational Online Podcast team for giving us this platform. So let's begin.
Yes, let's begin.
Kinju, you've blazed such a remarkable trail. What inspired you to pursue urology and robotic surgery, especially as the first female urologist from Nepal?
Honestly, to begin with, I had no idea that I would be the first female urologist of Nepal. It's purely based on my interest. During my general surgery training, I was very much interested in urology. I got a lot of exposures of urology during my training. So that inspired me. Unfortunately, I did not have anyone to look up to as a female role model in this field. However, it was filled with a bit of a challenge, but it was a great journey. And in terms of uro-oncology, it was purely out of passion. So again, I came to India. I did my uro-oncology training and robotic surgery training. Here also, I realized that there were no female exclusive robotic uro-onco surgeon here. Pathway was slightly different as opposed to how people would perceive, but it is exciting.
I see.
And Steffi, what do you feel? How does the leadership look like for women in urology in Hong Kong, and how did it feel for you to become a female urologist in Hong Kong?
I think that in Hong Kong, we kind of have a British system because we were under the British colony for some time. So our fellowship program is basically conjoined with the Royal College of Surgeons of Edinburgh. For me, the leadership wasn't like a position that I aspired to from the start. It's more of like responsibility that grew from necessity. Leadership from women to me is like creating this roadmap for others. It's also about ability, showing that it's possible for other juniors, not just like female juniors, to actively pull other female surgeons up as well. In Hong Kong, we have good support from the women's chapter at the Hong Kong College of Surgeons. So I believe we're quite privileged in Hong Kong.
Absolutely, I agree.
How did you grow into your leadership roles as well? And what does leadership mean to you personally?
Leadership for me has never been about the titles. It's just about building a pathway that we can pave onto later for juniors to come up and look up to. At HCG, after I completed my uro-oncology here in India, my main focus is to develop robotic pathways to train our fellows. We do have few fellows that come to us every 1.5 year. We do also have observers who come and look into how we do our cases, how we treat our patients, and also many urologists that come to us who also ask us to become proctors. On top of that, some collaborative research is trying to pave a pathway for other female urologists, if I can. We also have a women surgeon association in India. So that also kind of helps like giving a platform for women.
Sounds quite similar.
Yeah. So Steffi, you do a lot of researches, you have a lot of global experiences and exposures. How do you feel it is different in Hong Kong as compared to other global context?
Well, Hong Kong is a bit of a fascinating context because it's in the middle between the West and the East. And the Hong Kong's training is, as I've mentioned, is like internationally benchmarked together with the Edinburgh College. So through the from my global experience, international exposure, I was able to appreciate from the surgeons and mentors that I've learned from. They have undoubtedly upheld the standards at an international level, skills wise. And because of my training and overseas exposure, I was able to see the advantages that Hong Kong can bring in terms of technology that's very important in endourology. Like I'm able to get in touch with all the Chinese side of the new tech, as well as all FDA or CE approved new tech as well. So compared to other global contexts, I think maybe Hong Kong still has quite some improvement as in making leadership training or research mentorship more formal. We have less formal of a program compared to like American systems and European systems. Or in Hong Kong, exposure is excellent, but the next step is ensuring that our training programs can consciously build the skills for juniors to become leaders and innovators and not just mastering skills as surgeons.
Right.
So, what about your global experience influencing your practice in your institute?
It's eye-opening, actually. We do perceive European or US practices as a gold standard practice. However, I tend to realize that whenever we go internationally for a meeting or whenever we collaborate internationally, we do have the exposure, but it also feels like we can be resourceful ourselves in a resourceful, limited countries like Nepal. In India, where I am working, I'm very fortunate to have cutting edge technology. So, whatever happens globally, even in the Western side, those kind of cutting edge technology we do have here, and the work that we are doing here is almost similar. But that might not hold true for other countries where I had also worked and seen. For example, in Nepal, or I had the opportunity to see how urology and urological practices happen in Pakistan. So those places are might not be having a similar kind of a training pathways or exposures that is present globally.
I think it's very important for platforms like EAU to be able to spread the news on what's available out there for aspiring young ones.
Yes, and also to have probably an organization that helps specifically for women to have good representations globally in a meetings like this and having a podcast like this. It's very important.
Yeah. And also talking about training, highlighting on this concept, what do you think about mentorship? Like, how has it actively impacted your career?
Mentorship is very important. I feel it helps you judge, it helps you improve your skills. But sponsorship, I feel it is what changes the needle. For example, sponsorship changes your calendar, it changes your trajectory in the career. For example, if your name being added to as a lead surgeon in a robotic surgery, or you sharing a podium in an international national meeting locally or anywhere, or you've been included in a multicentric study. So this is actually changing your trajectory in the career rather than just guiding you. What do you feel? I mean, in your perspective, how does mentors have played in your journey?
I absolutely agree with you. It's been critical. Since my journey in endourology, I wouldn't be here without my mentors. All these mentors that I've met internationally from the European side or North American side, or even from China, Asia side, they're really friendly and able to provide crucial advice when I have some decision making process. And also, more importantly, as you've mentioned, they involve me in like international society activities that is important for international collaboration in terms of research or organizing a workshop masterclass and also involving me in leadership roles. So I'm not just learning from them, I'm also working and collaborating with them. They're like my powerful friends and ally.
But do you feel any barriers that you have perceived in Hong Kong or anywhere in the world where you go? Any kind of challenges that you've felt?
Well, partly in Asia society, we're more perceived as need for spending more time with family. So the
Right.
obvious issue of work-life balance is a thing. So I don't think it's a systemic challenge because there's this unconscious bias that you need to spend more time with the family, and there's a lack of infrastructure support in Hong Kong, especially. There's inadequate parental leave, lack of on-site childcare. I've been to Japan, and inside the hospital, there's a childcare system where
Nice.
my friends both, one is the anesthesiologist, the mother's an anesthesiologist, and the father's a urologist. They can both go to work and not be like busy about like putting a child in the daycare and then coming to work and then rushing to pick the child after work as well. So these are things that Hong Kong doesn't have. And like I admire their system to be so accommodating when I've traveled and visited those institutes. And I think this
Right.
will really help women, especially in surgery, when our working hours are quite long.
I absolutely agree. Yes.
Do you see any similar barriers?
Yeah. In terms of barrier here, I feel I think the society has changed a little bit. It has improved a little bit as compared to how it was a few decades ago, mostly. But I agree to what you are saying. The support system is very, very crucial, especially for women to pave a pathway for career and try to balance both. It's very critical. In terms of challenges, I think the mindset is what is more important. And the mindset starts from not just the patient, it's the mindset of your colleagues, your mindset of your doctors nearby, mindset of your family members. That is what's more important. And the challenges, as you said, what I tend to face was subtle biases, not an abrupt bias where no one will come in front of me and tell me you're a female urologist. But there are subtle biases that I used to face initially during my training when I pursued urology. But now, fortunately, the team is very good and there is no such thing as biases here. I don't know whether you will agree or not here, Steffi, but do you feel that women have to prove themselves more, especially in our part of the world, and have to doubly work hard to prove themselves?
I think sort of yes, but it's still a very positive environment. Every now and then, I still have a surprise from like especially older male patients when they walk into the
Yes.
consultation room and see a female urologist, the Asian perspective. But it dissolves within the first few minutes of consultation. Once they see that you're a competent doctor and you have empathy and you know what you're talking about and how to treat them, they actually just trust you. I think that for patients, it might be a good thing because female urologists may be less intimidating. And on the contrary, because our urology department is actually very male predominant, female patients walking in, one of them like burst into tears because she was hoping that she has a female consultant, like a urologist for consultation at that time. So it could be like a surprise or not a good thing, depending on the perception of that patient, I think.
I absolutely agree with the hesitation of the patient because here it's like me being having a special interest in prostate cancer. It's like a male surgeon entering a gynec or breast oncology. So I also do get a little bit of hesitation sometimes. As the society evolves, these hesitations has melted down. But like you said, with clear communication and I think being very objective about your outcomes, how your work has been before, and showing your track records helps the hesitation melt away.
Yeah. Let's share on how we manage work-life balance in such a demanding surgical career because like I'm constantly rushing and like fighting
Yes.
deadlines. Any words of wisdom for the audience?
Actually, I do not go after balance. I think balance is a very difficult aspect to get into in terms of work life. And when you are in an early phase of your career and when you want to build something, striking a balance will give you more anxiety. I feel of it as a little bit as a cadence where, there are certain weeks where your work is very intense, your surgeries are intense, and you will also have some weeks where you have little lighter work and you can focus on academics, you can focus on writing or other works. My non-negotiables are a little bit of family time, a little bit of your personal time as well, and going into blocks and not trying to do everything in every day. You cannot obviously do a big surgery, spend a lot of time in OR and hospital, and also strike a balance at home. That cannot happen, I feel. So try to create a block, try to create a rhythm that is sustainable over the decades. That is what I feel. What do you feel?
I have a similar philosophy. I can't balance. I just juggle with
Yes,
life and work and family and enjoy the happening, like since it's so busy. But I do prioritize. I feel blessed with the supportive system that I get the support from both the institute and from my family. So I think balance is not the key, but we just prioritize. And I'm a very crazy planner. I'm already planning ahead for 2026. So I guess I just plan ahead.
that's very interesting. Yeah. So what do you think would be your vision? What have you planned for in terms of how do you hope to see women in urology in future, broadly in Asia or globally?
So specifically for Asia, Hong Kong, for female urologists or surgeons, I think my vision is that we move from being the exception to being the norm.
Right.
We should be like as a whole, seen as a whole. I hope not to just see more women entering surgery, urology, but even ascending to more prominent roles in the department.
Yes, the leadership roles,
Yes,
right.
that is still lacking, maybe in Asia and better in other parts of the world. And having more robust, formal mentorship, sponsorship programs across with collaboration with the European side and internationally. I think that would really help the young ones to aspire and enter a career in urology. What about you? What do you think?
Yeah, I absolutely agree. I absolutely agree to that. Just in addition to that, I personally would want to see urological field where we do not need to talk about gender bias, where we do not need to talk about women in urology in future. It should be a norm, as you said. And also to have to build on to that, to have more inclusivity, because if you include women in each and every platforms, like you said, in collaboration in conferences, in researches, it improves the quality of
Absolutely.
those kind of events or meeting. It's not just about representation, I feel. It definitely improves the quality. So yeah, so it would I would like to see some leaders, more of a leaders in women in urology in future.
Definitely, Kinju, I agree. Like collaborative networks, like this conversation, EAU giving us a platform, women surgeons across
Yes.
Asia and internationally can share their knowledge, their experience and journey, and advocate collectively. And our strength is in our community. I do think so.
Yes, it's been such a privilege, Dr. Steffi, to share our thoughts alongside you. And it's very nice.
Yeah, thank you, Kinju.
Thank you very much, Steffi.
It's been my pleasure as well. It was a really, truly inspiring, insightful conversation. And I think our stories and perspective can try to help shape the field of urology and maybe light the way for countless future surgeons, not just female surgeons.
Yes, future male surgeons as well. Yeah,
Yeah. Let's thank our audience for joining us.
thank you.
Thank you for this insightful episode. We are sure our listeners enjoyed it. To keep up with the latest EAU podcasts and stay informed on urological advancements, be sure to subscribe to our EAU podcast channel on your favorite podcast app. Until next time, keep learning and stay inspired.